Hello, and welcome to my PowerPoint presentation titled Social Work Values. First of all, I would like to visit the subfields of the social working profession. These include veterinary social work, military social work, immigration social work, and forensic social work. Veterinary social work. Practitioner is responsible for providing on-site grief therapy for families and individuals who must put their pet down. Military social work. Skilled professionals who are equipped in handling PTSD, homelessness, and drug or alcohol addictions within persons who have experienced the effects of war. Immigrant social work involves helping children, individuals, and families with transitions, documentation, and readjustment to their environment. Forensic social work involves assessing and treating victims of crime, offenders, and felons that are released from prison. 4 different types of data analytics. First is descriptive analytics. This includes using statistics in order to observe what has happened in the past regarding the particular field of interest that is being studied. Diagnostic analytics. This involves deciding what caused what for the outcome to have happened. Predictive analytics. An attempt to guess what will possibly happen in the future based on past occurrences. Prescriptive analytics assesses what should be done in light of the past so that different outcomes will occur. Using data analytics. For descriptive analytics, this could look like describing outcomes to stakeholders within a business sphere of influence. Also, tracking past and present performances, which include successes and failures. Using diagnostic analytics looks like identifying data anomalies, collecting data related to those anomalies, and also using statistics to help explain those anomalies which have occurred. Predictive analytics looks like neural networking, decision trees, and regression, which are all related to mechanical learning. Prescriptive analytics, making data-driven decisions, and it relies on machine learning to find patterns in large data sets. Prescriptive analytics bases its decisions off of data that has been collected by the use of predictive analytics. The 6 phases of evidence-based practice. Number 1. Identify a question to ask. The practitioner must use the PIOCT method to form an educated question regarding a particular issue. Next, the practitioner searches for the best evidence to answer this question. They will use the hierarchy of evidence and will aim to obtain evidence from the first 3 levels which support the research question. The first 3 levels contain the most credible evidence. Number 3, conduct a rapid appraisal of the research. The source is reviewed to ensure that the study results are applicable, reliable, and transferable to the study which is being done. Number 4, the practitioner will integrate research evidence with organizational evidence, clinical expertise, and patients' preferences and values. The social worker must work to combine the research that they found with data analytics, their own professional experience, and client-specific needs. This step ensures that whatever research question is being asked is applicable to what the client themselves is needing in terms of services. Number 5, evaluate the outcomes of the evidence-based intervention. This includes assessing the outcome of the intervention method that was used for that particular client. Number 6, disseminate the findings and outcomes of the EBP change. This involves using descriptive data analytics in order to evaluate exactly what happened during the study. Step 6 involves using tools in order to look over what happened and what caused what within the study. Challenges within medical social work. One of the challenges is maintaining perfect health. This includes the feeling that many medical professionals may feel of pressure that they must maintain a healthy diet at all times, exercise obsessively, follow hand washing procedures totally, and also staying well at all times. Another is keeping distance. Many medical social workers have to make difficult decisions when it comes to attending family functions and hanging out with their friends. If a loved one is sick, they could infect the social worker. If the social worker carries something back with them from the hospital, like a disease or a sickness, it could also affect or spread to a loved one. Other issues are a lack of connection between the practitioner and the person who is unwell, their client. Due to the coronavirus pandemic, customer service became much more complicated to maintain for medical social workers. Not being able to communicate face-to-face, reducing physical treatment, and limiting how many people could visit a client at once have all contributed to the issue. Another problem is that practitioners feel criminalized by their clients. Many families of those who get hospitalized will criticize and blame medical professionals if they believe their loved one is not receiving the best possible care. There can oftentimes be so many patients with high demands, but so little medical helpers available in order to meet their needs within a particular facility. The 3 E's of trauma-informed care. The first E is event. This includes asking the client what actually happened in their own words. Experience. How the event was experienced by that person. This includes looking at factors such as the person's age, their prior history, and their available resources. The third E is the person's emotional, mental, physical, spiritual, social, or environmental circumstances after the trauma has occurred. R's of informed care. First is to realize. This involves the practitioner being aware of the larger impact of trauma and requires that they are knowledgeable about what recovery might look like for any particular client. Next is to recognize. Recognize the signs and symptoms of trauma that can be identified in clients, families, staff, and other people. Next is to respond. It involves using the practitioner's knowledge base to inform their policymaking, procedures, and practices that they implement for their client. Resisting re-traumatization. The practitioner does everything in their power to remove the client from a situation in which the trauma is occurring. The 6 principles of trauma-informed care. First is safety. This involves making all efforts to sustain and enhance the person's well-being. Next is trustworthiness. This requires that the social worker must honor their word and be transparent and clear about the expectations they have of their client. Next is choice. Maximizing the client's access to control and power during the helping relationship. This, of course, references the value, which is called client self-determination. Collaboration includes continually involving the client in decision-making and asking for their feedback. Empowerment includes skill building, focusing on client strengths, and promoting their resilience. Last is cultural, historical, and gender issues. This means that a practitioner will refuse to stereotype or hold biases against their client, and instead they will acknowledge their client's unique culture and respect it at all times. Ethical issues in using telehealth. The first issue could be boundaries. It is essential that the social worker explains the boundaries that must be kept when utilizing electronic services. For instance, he or she should caution the client to not try and friend them on social media, begin inappropriate correspondence through email, etc., as the practitioner is required to deny all such requests. Proper training and approval. A practitioner must seek proper telehealth training before implementing it as a part of their available services. They must consult the Social Work Licensing Board, IT professionals, attorneys, and other relevant persons to ensure that they're competent according to the state law. Self-determination. Clients may feel uneasy about sharing their personal information through technology. The social worker must be aware of the client's available resources and whether they have access to a computer for services. They must check that the client knows how to work the technology and even be willing to coach them through the process of launching the program. Security. Maintaining secure contact. Using strong passwords and secure browsers for the therapy call. If services are interrupted, there should be a backup plan at all times to continue that the session can resume elsewhere. Calling in a private location so that client information is kept confidential is mandatory. Social media challenges for social workers. The first being maintaining a private profile. It can be easy for a social worker to mistaken that their social media profile is on the private setting when in reality it might have gotten switched to a default public setting on accident. Not using names of clients, agencies, or places. Even if their profile is kept private, you never know who may know who, and you want to be careful of this possibility at all times, and so refraining from using specific client names, the names of agencies where you work, or places that you go to is important. Keeping secure contact with your clients. This includes making sure that you are only discussing very important confidential matters either in person or over the phone, speaking with your client, and not over text message. You want to be aware of the possibility of somebody else who is not your client picking up their phone and reading the messages that are confidential from their social worker. Stalking clients without consent. This could be in the best interest of the social worker, thinking that they are doing something to help their client by looking at their social media page, especially if it is kept public. However, this is a breach of their confidentiality and cannot be performed without their consent. Social media challenges for clients. These include social comparison, which could look like inferior or superior comparison, in which the client will either feel consumed by their own inadequacy or feel constantly driven to change themselves in order to fit the mold of whatever is trending. Both of these are common responses to the overuse of social media. Next is surface level relationships. This includes numbness to problems, lack of depth in personal relationships, and overall less meaningful engagement with people. Depression is another common form of social comparison, and it includes eating disorders, lack of sleep, and even thoughts of suicide are common effects of depression. Anxiety, feeling overly stimulated when a person is using their phone, or overwhelmed because it seems everyone is demanding their constant attention. This could look like trouble focusing on what is right in front of them because they are so used to constantly scrolling and engaging within seconds with other people online. Strategies for helping clients manage their social media. First, this could look like recognizing and addressing the symptoms and causes of the client's depression. Helping them to be made aware that they are expressing symptoms of depression is the first step. Help the client form a plan or choose a treatment that will best help them so that they are not overly consuming social media. This could look like encouraging the client to take a break from social media or temporarily deleting their profile for a time. Discussing the cause of social comparison, either inferior or superior, and then going with a treatment method from there. Encouraging them to have more physical activity. Exercising can easily combat the symptoms of depression. Political social work for me. Advocacy could look like using a platform of political social working to plead on behalf of children's rights. Another possibility is administration, which could look like managing invoices, updating calendars, delivering messages, and interacting with the public. Another possibility is voting, informing people about upcoming legislation and urging them to take actions regarding the matters that I believe are most important. Obviously, advocating for children is something that I value as being something that matters to me and is something that I am also passionate about. This could look like educating the community about the injustices that children are facing. Also, requesting support from the community in order to help fund housing that I plan to create. Lastly, this could look like involving myself at a political level and arranging to work with government officials in order to get grants, communicate with sponsors, and even ask for legal help when creating the homes that I plan to make for children.